Today we are going to talk about human immunodeficiency viruses. Okay, these are my learning objectives. As usual, we are going to define it and then we will do the epidemiology. In this topic, the important thing from the examination point of view and for your knowledge is that you should know the structure of the HIV virus and you should know its replication cycle. Now, question arises what HIV stands for. It is a human. You should remember that this is an RNA viruses which is found only in the humans. This is transmitted among the humans and is preventable by the humans. I stands for the immunodeficiency. Body lacks the ability to fight the infection. Immunodeficiency means when you are not able to fight the infections, your immunological processes are weakened. V in this stands for a virus. And remember that this is called a retroviruses. Word retroviruses is a term used for the viruses which have got an enzyme called reverse transcriptase. Reverse transcriptase helps in forming a RNA virus converting into a DNA. The word we use is a central dogma of the genetics and transmission, in which first a DNA replicates, then it forms one stand, and that is converted into a RNA. The viruses like a HIV are called retro because they have got this enzyme, reverse transcriptase, and by the help of this, they cause formation of the DNA in the host cells. Now, we should know that how many forms are there. Usually, it enters the human population from the primates, and here the usually monkeys meat is involved in it. There are two serotypes of the HIV. HIV-1, which is called is, is the most prevalent HIV strains, and it is found mostly in the chimpanzees. HIV-2 जो है वो सूटी मंगोलियाई एक species है of the monkeys. It is present there. This is how they look like, the two species. For you, you should know that there are two strains of HIV. Now, HIV and HIV-2 both have the characteristic that they both are transmitted through the same route, both are opportunistic infections. You should know the definitions of the opportunistic infections and you should understand it. It is more, HIV is more common and it is found in West Africa, while HIV-2 is less pathogenic and has a shorter duration. Now, coming to the structure of the viruses, we should know that. We should know that this HIV virus is an enveloped single-stranded RNA belonging to a Retroviridae family and lentiviruses. It replicates actively and dividing in the T4 cells. So T4 lymphocytes are involved. The virus can remain in the lymphoid tissue in a latent phase for a very long time. You should know what is a latent phase of a virus. I've already explained you that. Now, in this HIV, the characteristic is that a person gets HIV infection and they usually remain symptomless or carrier for years before the symptoms actually appear. Now, RNA viruses, as I told you, that they can be injected into the host cells. Host cells DNA is used to make the viral RNA, the DNA from the viral RNA. And viral RNA uses the reverse transcriptase enzyme to make the viral DNA. And these viral DNA become aproviruses and they keep on producing new viruses without killing the cells first. Human deficiency viruses usually over the years, when a person gets immunodeficient, then they are converted into the AIDS. Everyone with AIDS is infected with HIV. HIV results due to the progression of the HIV infections, or everyone infected with HIV, although healthy, can have a. Now, the thing to remember that HIV or AIDS है वो आपके कौन से cells पे करता है? So you should remember the name CD4 T cells. They are normally involved. Now the normal count of the CD4 is between 500 to 1500 units. As a patient deteriorates and its immunodeficiency development occurs, so the CD4 count gets slowly decreased. Now you will then label the patient as a sure case of AIDS when a person has a CD4 count of 200 or a person's CD4 count decreases and they become more opportunistic. The root of the infections and how the risk factors are, these are the main unsafe sex. So yeah, men having sex with men, IDUs, migrant ovulation, low status of the women उनकी professionally sex related होती है, they have it or there is a, these are the causes of it. Now remember these things अगर आप इस heading से याद कर लो तो किसकी sexual causes है जिसमें heterosexuality, homosexuality, then number two route of the transmission is blood and the blood products, which is common in the IV drug users, then in the transfusion reactions, hemophilia, and other instruments if they are used. Vertical transmission, which is a transmission from a mother to the baby, it's can occur during the pregnancy, during the birth, and by breastfeeding. Now, these are the body fluids in which you can find the HIV. Semen may present, breast milk may, blood may, vaginal fluid may. So in exam, they ask you, name the fluids which have the HIV. The secretions which do not have the HIV are tears, saliva, sweat, urine of the infected person. Incubation period is very long and very slow process. 75% of the people infected with HIV will develop AIDS, and usually it is nearly 8 to 10 years to develop that. Depending on the severity, the illness is how serious it is. It depends on the viral load and the count, CD4 count decrease. अगर viral load ज़्यादा है तो naturally the CD count will decrease rapidly. Higher the viral load, sooner will be the immune suppression. Now this is a very important diagram. You learn the labeling of it. आपको exam में OSCE में they show you this diagram. It is there, and then they ask you different questions. So you just have to learn the names of the things which are present. Now the important thing is that this HIV virus has got multiple proteins. Now you should remember the proteins name which are structural, which are regulatory, and which are accessory. These three things which are written in heading, you should know the examples. In your MCQs, you can be given few names of the proteins. Among this, you have to decide the regulatory proteins and accessory proteins. Okay, this is pure memory question. Among the structured proteins, you should know that there are three main structured proteins. One is called GAP, pol, and envelope. Now, GAP is for encoding the matrix capsid and are structured proteins, while the pol that is a encoding protease और इसके अंदर protease, reverse transcriptase और integrase enzymes present होते हैं. इनकी वजह से इसका structure integrity रहती है. जो envelope proteins है वो outer structure में होती है and it has got surface antigens labeled as GP160 and consist of 120 GP and GP41. These are the names which you have to learn present in the HIV. Now, if we talk about the life cycle, you know that most of the steps or the stages of a life cycle of viruses are same. In HIV, the first stage is called budding, then reverse transcriptation, integration, transcription, translation, assembly, and budding. So you should, in your OSCE, should know the steps and the stages of a life cycle. Now this, if you understand this diagram, everything will be clear. You see a circular disc, brown color key with yellow run DNA is the HIV. Suppose it's a HIV virus. It enters into the host cell, and in the host cell, it gets its DNA is converted into small pieces. Now here the diamond green color is showing reverse transcriptase. Due to this, it will be from a single stranded, it will be first converted into a double stranded RNA, and when it will enter the host nucleus, it will be converted into a DNA, and it will get incorporated into the DNA of the host. The yellow color is of the virus DNA and the host DNA is by the pink color. Now, after getting incorporated, it produces progenies, means multiple copies of again single-stranded RNAs, and then we can see कि जो सारा structure है, they get assembled, and once they are assembled into a single-stranded RNA viruses, they come out of the host cells and causes a budding. See, this is an attachment to the CD4 cells. From here, it is getting into the reverse transcriptase. To follow this diagram, then integration into the host cells. I've explained you this process. Then the reproduction of the viral components will lead to the formation, and finally there will be assembly and release. This diagram is very good to get the concept. Now remember that in the life cycle and replication, there is a binding. You should know that the binding site of the virus is with GP120. Another MCQ question, okay? And the cells which can be attached with are T cells, macrophages, or the microglial cells. Once it is attached to the CD4 GP120, then GP41 will bind to the chemokines. The important chemokines involved, you should remember, are CCXR5 and CXCR4. The fusion between the cell membrane and the viron is through these. Now, in the binding and the fusion, remember that GP120 and GP141 proteins bind to the surface receptors of the CD4 cells directly, and then with the co-receptors, which are, remember the names, CCR5 and CXCR4. Viral membrane fuses with the cell membrane, and viral contents are released into the cell. See, this is a diagram which is showing you the things I've explained. If you just remember the knob kahan hai, usme aapne 120 likhna hai, jo uski projections ho rahi hai, that is GP41. Now, in reverse, second set of reverse transcription ho rahi hoti hai, so reverse transcriptase helps the DNA viral banane ke liye, aur this splicing occurs through the integrase, and DNA is persistent in the latent state until the cell is activated. In transcription and translation, there is an activation of the viral infected cells, and this is transcribed into the messenger RNA, and this messenger RNA is transmitted or is conveyed to the next level. In assembly, budding, and maturation, you should remember that the HIV protein enzymes and viral RNA assemble and they get into a form of new budding, new cells of the virus. The virus buds form from the cell. Protease enzyme cleaves the long protein strands into the small functional HIV proteins and enzymes, and they get organized and form a mature HIV particle. Now they will be able to infect other cells and replicate. See, this is showing you that if you follow the steps, you can understand that आपको virus का जो था वो DNA के देखो nucleus में आके integrate हो गया in a purple shape में, और the single stranded gets into the released into the cytoplasm again, and through budding they are coming out of the host cells. Now the phases. Phase 1 clinically how you will recognize. It is very difficult initially to say that a patient has got HIV, because in phase 1 usually, as in the most viruses, patients are asymptomatic, and with progression of the time they can have a chronic lymphadenopathy, means that lymph nodes are enlarged. In phase 2, they become symptomatic, and this is indication of the immune failure. In phase 3, patient has developed full-fledged HIV infection. He has become immunocompromised. A time has lapsed in years, and now the patient is in a AIDS. Phase 3 में usually AIDS होता है. पता कैसे चलते हैं? Because in this, when a person gets into the AIDS, there are signs and symptoms of different opportunistic infections. You should know the names of the opportunistic infections which occur in a AIDS patient. I'll be explaining you, but remember cytomegalovirus, TB, pneumocystis, toxoplasmosis, and Kiboski sarcomas are few of the infections or the diseases which occurs in a AIDS patient. Phase 1 और 2 में क्या होता है कि पेशेंट जो होता है वो उसको हम एड्स लेबल नहीं करते थे, लेकिन अगर वो एसिम्प्टोमेटिक था और उसका CD4 काउंट लेस देन 200 है तो आप उसको एड्स बोलोगे. एड तब तक डायग्नोज नहीं कर लेबल नहीं करना है जब तक आपका CD4 काउंट इज लेस देन 200, बिकॉज यू सी most of the patient are asymptomatic. उनको पता ही नहीं चल रहा होता, वो silently their CD4 cells are getting infected and they are getting destroyed. इसी तरह से usually it takes years to develop. Now the good thing is the people who are lacking CCR5, they are resistant to the HIV infection. ठीक है, तो MCQs के लिए आपको नाम याद रखना है CCR5 responsible. Now coming to the, जैसे मैंने आपको बताया थे phases और stages हैं, तो what is virus doing? In acute stage, HIV is getting replicated, virus is getting replicated, or energy requirements of the host are increased. Okay, viruses को fight करना होता है. इसी तरह से जो asymptomatic है उसमें usually patient के अंदर कोई symptoms नहीं होते या prodromal symptoms होते हैं like flu, swollen glands, fatigue, diarrhea. Infected person can infect the other people in this stage. This lasts for 10 years, or HIV antibodies are detected in the asymptomatic or latent infections. In symptomatic, the symptoms जो भी develop होगा वो आहिस्ता आहिस्ता deteriorate करेगा, worsen होते चले जाएंगे. Especially there will be a mental changes, abnormal thinking pattern आ जाएगा और onset of the opportunistic infections आ जाएगी. In late symptomatic condition, which is a full-blown AIDS, ये आपको viral load से पता चल जाता है और patient के अंदर intense weight loss और wasting हो जाता है. As I explained to you that the AIDS patient is recognized either by the very low CD4 count or by the signs and symptoms of the other opportunistic infections which they are suffering from. So these are the general symptomatic symptoms which develop like fever, fatigue, swollen lymph nodes, diarrhea, weight loss, oral yeast, shingles, and pneumonia. Oral yeast, shingles, and pneumonia are the opportunistic infections. These are occurring due to the low immunity count. Now, I told you that HIV ultimately over the years is converted into AIDS and it takes 8 to 10 years. Now, remember when a person develops opportunistic infections, they are able to get the opportunistic cancers also. So these are the important infections which occur in the AIDS patient. नाम आपको याद करने हैं. Clinical features at this stage of pathology you don't know, but once you go in the final year, you have to recognize. But for your pathological knowledge, you should know that the other opportunistic infections or the other infections a person of AIDS can have. First है pneumocystis pneumonia, candidiasis, tuberculosis. Then cancers which occur are cytomegaloviruses, cryptococcal meningitis, toxoplasmosis. This is a very important question. जो आपसे पूछा जाता है कि name few diseases which a patient suffers from. तो ये नाम लेनी है. Now coming to the cancer, you should know the names of the cancers which can develop in a AIDS patient. सबसे इम्पोर्टेंट उसमें Kaposi sarcoma आ जाते हैं और lymphomas आ जाते हैं. अब इसमें क्या होता है, lymphomas हमें पता है कि cancer starts in the white blood cells और it is an early sign in a जब patient का lymph node पेनलेसली इलाज हुआ होगा नेक में, आर्मपिट में और ग्रॉइन में। इनका पास जो टेपोस्की सार्कोमा है उसमें क्या होता है कि इट्स अ ट्यूमर ऑफ द ब्लड वेसल वॉल और usually appears as pink, red or purple lesions on the skin and the mouth. And in people with a darker skin, it's more important. इसी तरह से थर्ड जो कैंसर आ सकता है वो जो ह्यूमन पेपिलोमा वायरस से रिलेटेड कैंसर्स होते हैं, राइट? उसको हम HPV वायरस कहते हैं कैंसर्स। और इसमें हमारे जो पेशेंट की इन्वॉल्वमेंट होती है एनल, ओरल और सर्वाइकल कैंसर्स आ जाते हैं। Now the complications patients को जो डेवलप होती हैं वो विद, जैसे आपको पता है कि उसके सिम्टम्स इस स्टेज में वो आएगा, उसके बाद उसकी अपॉर्चुनिस्टिक इन्फेक्शंस आ जाएंगी। अगर उसको कोई सा भी इसमें से एक या दो कैंसर के सिम्टम्स डेवलप होते हैं पेशेंट जो होगा वो डेवलप करेगा वेरी फास्ट द कॉम्प्लिकेशंस। Now, in the complications, you should know there is a wasting syndrome in which the muscles of the body start deteriorating. Patient को neurological complications हो जाती हैं। It's a AIDS syndrome, हम इसीलिए बोलते हैं syndrome क्योंकि multiple systems are involved. जब किडनी इन्वॉल्व हो जाती है तो उसमें क्या होता है कि पेशेंट का जो टाइनी फिल्ट्रेटिंग प्रोसेस है वो खराब हो जाते हैं। और ये लिवर डिजीजेस के अंदर it's a major complication, or especially in the people who have hepatitis B and C. Now the question arises how you will know. For your third year knowledge, you should know the structure of the HIV, its replication, and the symptoms. Not in so much detail, but you should know the names. Now you will diagnose clinical pathologically. आप substances को diagnose करोगे. Remember, for viruses we go for the serological test. और HIV के लिए हम दो तरह के serological test करते हैं, उसको block कर देते हैं into a screening group and the confirmatory group. The certain cells are for the screening and certain names are for the confirmation. Now, in a screening means that in a community you want to see how many patients are suffering from HIV. This is usually done by ELISA, or this is the best screening assay with 100%. But results, but specificity or sensitivity is nearly 100%. But in few cases, you can have false positive or negative reactions can also occur. कंफर्म कैसे करोगे? जब किसी का स्क्रीनिंग में आ गया तो आप कंफर्म कराते हो। उसके लिए अभी तक वेस्ट ब्लॉट, दे आर, आई टोल्ड यू देयर आर 3 टाइप ऑफ ब्लॉट, नॉर्थ ब्लॉट, साउथ ब्लॉट एंड वेस्ट ब्लॉट। सो वेस्ट ब्लॉट इज कंसिडर्ड एज अ गोल्ड स्टैंडर्ड और ये अभी तक हमारा कंफर्मेशन के लिए ये यूज होता है। जब किसी पेशेंट को आप सस्पेक्ट कर रहे होते हो तो आप उसका वेस्ट ब्लॉट कराओगे और आपको पता चल जाएगा। इसी तरह से दे आर सर्टन टेस्ट, आपने जब एंटीजन एंटीबॉडी टेस्टिंग करनी है फॉर HIV डायग्नोसिस तो आप एलाइजा से कराते हो। सर्टन रैपिड टेस्ट होते हैं जो फिर से किए जाते हैं और वेस्टर्न ब्लॉट। In infants, if you want to diagnose कि उसको मदर से ट्रांसमिट हुई है कि नहीं हुई है, through any route, you will do P24 count. Then for initiating that treatment, you need to do और मॉनिटरिंग करने के लिए जो आप ट्रीटमेंट स्टार्ट करते होते हो जिसको हम ART ट्रीटमेंट कहते हैं, उसके लिए आपको फ्रीक्वेंट पेशेंट का CD4 और वायरल लोड कराना होता है। So remember the names and their aims for doing it. क्लिनिकली जो है WHO ने इसको डिफाइन किया कि आप पेशेंट को कब लेबल करोगे। रिमेंबर, यू कांट बी कैजुअल अबाउट इट बिकॉज इट्स अ मैटर ऑफ अ लाइफ। आपने एड्स के लिए आपको देखना है, अगर पेशेंट के अंदर ये मेजर साइंस हैं, वेट लॉस इज ग्रेटर देन 10%, फिर उसको क्रोनिक डायरिया रह रहा है फॉर मंथ्स, इसी तरह से देयर इज अ हिस्ट्री ऑफ लॉन्ग फीवर। माइनर साइंस के अंदर आपके आ जाती है कि उसको परसिस्टेंट कफ हो, प्लूराइटिस हो, हिस्ट्री ऑफ herpes हो, ओरोफेरेंजियल कैंडिडियासिस हो या जनरलाइज्ड लिम्फेटिक एडेनोपैथी हो। ठीक है, मे बी नेगेटिव ड्यूरिंग द फर्स्ट 3 months आफ्टर द इन्फेक्शन, इसको हम विंडो पीरियड कहते हैं कि हमें HIV करा रहे हैं लेकिन अगर वो पेशेंट विंडो पीरियड में है तो यू विल नॉट गेट द रिजल्ट। इसी तरह से 2 टेस्ट आर रिक्वायर्ड प्लस अ थर्ड टू कंफर्म। अगर एक में पॉजिटिव आ रहा थोड़े दिन के बाद कराया तो वो, सपोज फर्स्ट नेगेटिव आया था 2-3 महीने के बाद कराया तो वो पॉजिटिव हो गया, तो ये कॉन्फ्लिक्टिंग रिजल्ट है, तो आपको करने के लिए रिपीट कराना। ये दो टर्म्स हैं जो आपको आने चाहिए. विंडो पीरियड. What is a window period? It is a time between potential exposure to any virus infection and the appearance of the antibodies in the blood. ये सब viruses में window period आता है. तो ये first incubation and it is slightly different from the incubation period which we have done in the bacteria. Seroconversion में क्या होता है कि antibody responses to the disease उसमें सीरो कन्वर्जन कर रहे होते हैं. इट occurs when our bodies first begin to produce antibodies. तो सीरो कन्वर्जन के अंदर जब बॉडीज बनती हैं. वायरल लोड मींस द अमाउंट ऑफ द HIV इन द. दिस इज द डायग्राम जस्ट टू गिव यू द कॉन्सेप्ट के पेशेंट के नीचे वो दिखाया हुआ है कि उसके वीक्स ऑफ इन्फेक्शंस हैं और उसके अंदर अगर आप इसको डिटेल में स्टडी करना चाहो समझने के लिए तो अंडरस्टैंड करने की ये बात है कि देखो नीचे ईयर्स और वीक्स लिखा हुआ है और विंडो पीरियड इज एग्जिस्टिंग अप टिल अ मंथ. उसका पेशेंट का आपका बार बार इसलिए रिपीट करने की जरूरत नहीं होती. द थिंग टू रिमेंबर इज आपने एक टेस्ट कराया सपोज वो नेगेटिव आ रहा है तो वेट फॉर सम टाइम बिकॉज द पेशेंट इज इन अ विंडो पीरियड तो आपको कुछ भी नहीं मिलेगा. इसी तरह से जब पेशेंट एसिम्प्टोमेटिक होता है तो उसमें भी आपके जो रिजल्ट्स हैं वो थोड़े से पॉजिटिव नहीं आते हैं. अब आपने देखना है कि पेशेंट का क्या रिस्पॉन्स है टू द ट्रीटमेंट तो आप उसके अंदर पेशेंट का वायरल लोड और P24 कराएंगे. अगर आपने पेशेंट की इम्यून रिस्पॉन्स देखनी है तो आप एंटीबॉडीज कराओगे जिसमें IgG और IgM होगी और CD4 सेल काउंट कराओगे. ठीक है. सो मोस्ट कॉमनली वी यूज ELISA. आफ्टर द ELISA द गोल्ड स्टैंडर्ड इज अ वेस्टर्न ब्लॉट. इसी तरह से हम रेडियो इम्यूनो बाइंडिंग एसेस करा देते हैं बट दिस इज एन एक्सपेंसिव टेस्ट एंड यूज एज अ कंफर्मेटरी टेस्ट व्हेन द एंटीबॉडीज आर लो. अगर आपके पेशेंट की एंटीबॉडीज मुसलसल लो आ रही हैं तो आप ऑप्ट कर सकते हो फॉर द रेडियो इम्यूनो बाइंडिंग एसे. इसी तरह से जो डॉट 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 इम्यूनो एसे है ये भी एक्सपेंसिव है लेकिन ये भी यूज कर सकते हैं फॉर द स्क्रीनिंग. PCR जो सा है वो सबसे ज्यादा ठीक है जब पेशेंट का डायग्नोज हो जाता है तो आपको HIV की जो भी जेनेटिक इंफॉर्मेशन है वो मिलती रहेगी. Now these are the few pictures which are showing you the complications which are occurring or the co-infections which are occurring in a patient of AIDS. Pictures दिखा के आपकी हॉस्पिटल में आ सकते हैं. ये देखो देखिए at the site of the town. क्लिनिकली में आपका जब आप फाइनल ईयर में जाओगे तो ये आपको डिटेल में की जाएगी. एट थर्ड ईयर लेवल यू शुड नो द नेम्स ओनली एंड फॉर एग्जांपल अगर ऐसी एक पिक्चर लगी हुई और सिनेरियो में लिखा हुआ है जिससे आपको पता चल रहा है कि पेशेंट है तो ये इसको केपोस्की सार्कोमा है. पेशेंट्स में सबसे ज्यादा जो फ्रीक्वेंट अकर करता है वो कैंडिडल इन्फेक्शंस करती है एंड दिस अकर्स एज अ सूडो मेम्ब्रेन ऑन द आप देख सकते हो ऑन द राइट साइड that on the tonsils there is a light white रंग का curdy membrane. Thank you so much. Zishan.